Hi, welcome to this video series, Supervision Moments. This is the 6th video in the series. It's recorded for June 2025. I hope you'll tune in with each new guest interview. I'm Dr. Susan Thompson, and with me today is Tom Seguin, who's a PhD and an LPC and an approved clinical supervisor. He's also the clinical supervisor at the Lemich Clinic for Military Mental Health in Norfolk and has been a clinical supervisor since 2020 when he was in private practice in Lincoln, Nebraska. So through Tom's doctoral training at ODU, he is both a professor and also in private practice. So Tom's supervised pre-licensed and mid-level licensed clinicians previously in Nebraska and is providing supervision to residents and also interns in Virginia.
Yep.
So, Tom, I appreciate your willingness to talk a little bit today.
Yeah, thanks. Happy to be
I've
here.
I've asked you to talk about one thing that you want other supervisors to know and one recommendation that you have. So take it away.
All right. Yes. So the one thing that I would just it's almost like a reminder, I think, for supervisors, clinical supervisors, like obviously it's important to think about, we wear a lot of different hats at the same time as a clinical supervisor. So you have to think about your clients' need, your supervisees' clients' needs as you're doing supervision, and you think about your supervisees' development and where they want to go and where you think they need to go, right? But I would encourage you also to think about the mentorship piece, and I think sometimes that gets lost a little bit in like all the theory and just kind of the supervisor training, right? Just like this idea that being out there and we're helping each other and we're supporting each other as colleagues and as fellow clinicians, in addition to supervisee relationships. And so things um, that I would want, my supervisee, or if I was a supervisor, I would want to consider for my supervisees is like site specific things that would help them be successful. So that might be like advertising, right? How do you do advertising, or how do you get your business off the ground, or how do you make connections with other places out in the community? And how can I help my supervisees learn to do those things? So like, I don't necessarily only want them to learn how to become autonomous counselors, but I also want them to learn how to be confident as they are autonomous, and how do they learn to wield their power that they have in the community, and how do they learn to become advocates, for their clients and for their communities. And I don't just necessarily want you to grow, obviously I do, but I want you to learn how to continue to grow when our relationship is done, right? So kind of like on that meta level of how do I not just help you grow, but how do you learn to see your own growth through that lens, and your own power and your own ability to then become the agent of change in your community that you want to see.
Right.
Yeah, so that's it, right? Like, take that step back as a supervisor and think about helping your supervisees not just grow, but become agents of change.
Mhm.
And so the resource that I recommend is kind of along those lines. It's uh, Pedagogy of the Oppressed is a book by Paulo Freire, and it just kind of goes into that idea of what you're doing as an educator, and as a supervisor you have an educator hat on sometimes,
Yep.
and the whole point of passing on knowledge to somebody else is to give them the ability to take that and shape their world in the way that they see it needs to be shaped in order to better fit the needs of the people that they interact with. Um, So that's it. I mean, that's my recommendation.
That's great. I love hearing about the suggestions and recommendations. So there you have it. One thing. Remember, you're also a mentor and you're here to help supervisees be successful in their future practice and in their growth and development. And then the book, The Pedagogy of the Oppressed,
Yep.
as a way to also help supervisees shape their world. Thank you so much, Tom. I appreciate your time and energy, and wisdom.
Thanks, Susan.
Take good care.
You too.